welcome everyone. Today we welcome Dr. Yasir Irfat. He is a gastroenterology trainee at the Lahore General Hospital. Thank you so much, Dr. Yasir, for giving us your valuable time. Can you please introduce to our audience where do you work and what's your experience so far?
Okay, thank you so much, Dr. Omar, for giving me this opportunity. My name is Dr. Yasir Irfat, and currently I'm working as postgraduate resident in the field of interventional gastroenterology and hepatology in Lahore General Hospital, Lahore, Pakistan.
All right, and how many years of experience you have so far?
I'm working here for 2 years in the field of gastroenterology in Lahore General Hospital.
All right, so we will move forward. As you know, our platform is mostly for the public awareness. So we just wanted to know that what kind of cases you see in the field of gastroenterology, mostly in the Lahore and nearby areas.
Okay, so as far as Lahore and Pakistan is concerned, um, I would like to split these diseases in two kind of diseases, like GI-related diseases and hepatobiliary-related diseases. Okay, so as far as GI-related diseases are concerned, we usually have patients, most of the patient we face having H. pylori associated gastritis, peptic ulcer disease, and intestinal TB is actually very prevalent here. Ulcerative colitis is more common as compared to Crohn disease in Pakistan. Then giardiasis and some cases of malignancies also very prevalent in Pakistan. And as far as hepatobiliary diseases are concerned, cirrhosis, actually hepatitis associated, like C and hepatitis B associated cirrhosis is very prevalent in Pakistan. And the cases of obstructive jaundice, most of the time they come with, you can say, choledocholithiasis related obstructive jaundice, and sometimes malignancies and mass factor related obstructive jaundice.
All right, thank you so much for elaborating. So now we are talking about the liver cirrhosis, as you mentioned about it's mostly due to the hepatitis related cirrhosis that's more prevalent. What do you think about the non-alcoholic and non-hepatitis related cirrhosis likely due to the obesity in the general
Yeah.
population? What do you think about those trends? Are these coming up or it's still low in the Lahore and nearby areas?
Yeah, in Pakistan, as I told that most of the cirrhosis are related with hepatitis C and hepatitis B. But the alarming thing is that fatty liver disease is now becoming very prevalent in also in Pakistan. I think so due to the sedentary lifestyle and dietary habit modifications and advanced people prefer the processed food and high calorie food and high fat food. And I would like to tell you that autoimmune liver diseases are also becoming prevalent in Pakistan as far as the hepatitis, as far as the cirrhosis is concerned.
All right, that's really alarming. As and there are like few things that we can control is that's the diet, and the other thing is to prevent the hepatitis, to prevent these deadly diseases. So, how often you encounters the liver failure patients, and how liver transplantation evaluation works for the patients, and how teams work collaboratively, and what's the best institutes you refer for the liver transplant, and any physicians you want to recommend to our general public.
Okay, so as cirrhosis is very prevalent, so it's very often that we see the cases of DCLD, and we usually use the criteria scoring system and CTP scoring system to classify the patients and to screen the patient for liver transplant selection. As far as the centers are, the coordination is concerned, we actually in this Lahore hospital, Lahore General Hospital, we do not have transplant surgeons here, but we have a good setup of gastroenterology. But transplant surgeons are not present in this hospital. So we write a proper call mentioning the proper history, examination, new updated labs with all file to the one of the well-renowned hospital, PKLA, which is actually Pakistan Kidney and Liver Transplant Center. The physicians and surgeons, they have a proper team. They evaluate that case, and then they examine that case. Then they give their opinion, and then we shift the patient in PKLA. So why we shift the patients in PKLA? Actually, we have very few options in Pakistan for the liver transplant. But this CKLA setup is actually very well established, well equipped setup. They have good, competent team, and the other concern is financial concern. So it is financially affordable in our area. The second hospital is Sheikh Zayed, but the number of cases they entertain very few number of cases in Sheikh Zayed Hospital. So our preference is Pakistan Kidney and Liver Transplant Center in Lahore.
All right, sounds good. Thank you so much for giving your references. So now we are talking about the finances. I know it may not be the very accurate, but do you have any idea how much it costs for the patients for the liver transplant in these two hospitals?
Uh, Okay, previously it was actually these two hospitals, they deal on charity basis also. They classify the patients according to their financial status. Previously it used to be around 7 to 8 million Pakistani rupees. Okay, so for the previous few months, the good news is that the government is involved in this liver transplant process. Okay, so most of the patient get no nowadays. Most of the patient gets fully funded liver transplant from the government and some from charity NGOs, and they help the patient. And we have sent many patients on zero balance, you can say, or totally free liver transplant. So it's something very good to tell about Pakistan, about liver transplant.
All right, that's really impressive. Then, and that's something new. I have never heard of it. That we have the government initiated transplant projects that's going on. So my
Mm.
next question is like to my understanding, Lahore General Hospital is a big tertiary care hospital, and by that time we get the patients here, they are very decompensated and their conditions are very advanced. So how do you think
Yes.
that the primary care providers referrals could be more beneficial if they start sending the patients early and we can work it up and can some prevent some disasters?
Yeah, this is actually a very relevant, very important question. Primary care health can help us a lot. Actually, it's important if they do some educational sessions in community, and they can organize different sessions to educate the people about disease. The main thing is they should teach, they should educate people by pamphlets, by classes, any method to educate them about the prevention of disease. Then screening and early diagnosis is very important. If they diagnose earlier, then we can have cases in better condition and with better prognosis. So on the primary healthcare levels, we have to invest. There is a lot of space to improve. Actually, let me tell you, in Pakistan. Okay, so we can improve it by educating the community and primary care physicians about screening and early detection of the disease.
All right, thank you so much. So, as now we are talking about the education of the community, that's the whole purpose of global gastroenterology. We want to increase the awareness among the people of different areas of the different countries. So, now we are talking about the educations of especially liver cirrhosis. So, we have some support groups like liver cirrhosis, pancreatitis, acute pancreatitis, chronic pancreatitis, IBD. So, what do you recommend? Do you have any educational tips, any general advice for any of our support groups?
Okay, so as far as these our tertiary care setup in what we are doing here, actually we are doing the classes on weekly basis, in which we educate our physicians, our trainees, our juniors. The seniors are very actively involved in this. they educate us about the updated knowledge, updated guidelines, and the challenging cases in our setup they have done in endoscopy suite or in other setups. So they present those cases to us, and they educate and give us about the updated knowledge. So these update classes on this, and regular based senior junior interaction and the case presentation is very important to improve all in these fields.
All right, sounds good. Now we'll have some questions for the just healthcare professionals. So one important questions: you are in the daunting field of gastroenterology and you work in like a very big hospital. So how do you prevent the burnout and how do you enjoy your work?
Okay, so it's a kind of personal question. I have I usually prefer for myself, and I advise my juniors also to have some physical activity on daily basis. Give some time, at least 1 hour, to yourself. Okay, so by this physical activity and have some healthy hobbies, which can help us to improve our mental and physical health, along with our busy routine. Along with our busy routine and all these days workouts and wards and emergencies. So we should give at least 1 hour for physical activity or some hobby, which can improve our mental health.
All right, and that's nice. And here we will conclude. Thank you so much, Dr. Yasir, for giving your time. We really appreciate and hope your information will be useful for the general public.
Okay, thank you so much, Dr.
Thank
Umar,
you
for
so
giving
much.
me this opportunity.
Have a good night.